Hi guys, my name's Marissa Bell. I'm a specialist orthodontist working in North London and Hertfordshire. It is important for me to communicate effectively with my patients as to how their oral hygiene needs will change during orthodontic treatment. At a patient's initial consultation appointment, oral hygiene is introduced into the conversation from the perspective of how there are different oral hygiene requirements between the different types of orthodontic appliances, but also to lay a firm foundation that regardless of the type of orthodontic appliance that they choose, or whether treatment's not even pursued, that oral hygiene is the most important factor of a patient's oral health and well-being. The biggest oral healthcare challenge that my patients face is that their new oral hygiene routine is going to be much more time-consuming than previously. My patients all have busy schedules, and finding that extra time to adopt a new, lengthier oral hygiene regime is usually the biggest barrier to them adapting successfully. It's therefore really important that I have the right tools in place to make this transition as smooth as possible. My gold standard for patients undergoing orthodontic treatment are as follows. For patients with clear aligners, they need to brush their teeth for 2 minutes twice a day and brush their aligners twice daily too. For patients with fixed braces, they need to brush their teeth for 2 minutes 3 times a day and then use additional brushes to go around the brackets and beneath the wires. This third extra brushing session should ideally be after lunch, but for a child during term time, I recommend it's when they get home from school. The oral health tools that I recommend to my patients are tailored to their individual needs, whether in terms of dexterity or motivation. Whether my patient has a good standard of oral hygiene or whether they are struggling maybe in terms of either dexterity or compliance, my recommendation to all these patients would not change. It simply would be to use a Philips Sonicare, as this makes their toothbrushing so much easier. The new Philips Sonicare supports all of my patients' oral health, regardless of which type of orthodontic appliance they have. For me, the standout feature of this toothbrush is that it is not technique sensitive, so my patients can continue to use the techniques they have always used with a manual brush, so brushing feels natural and straightforward. The time sensor guides my patients for how long to spend in each quadrant, and the optical pressure sensor allows them to accurately apply the correct level of pressure, so they're being kind to their gingiva and not introducing or exacerbating recession. The handle is light and comfortable to hold, making brushing feel effortless.